How to manage side effects of MS steroid treatments. One of the most common treatments for multiple sclerosis is the use of corticosteroids. Although steroid treatment can reduce inflammation, it also comes with some unpleasant side effects. Common reactions include indigestion, stomach pain, a metallic taste, insomnia, mood swings, depression, heightened appetite, headaches, heart palpitations, chest pain, swollen ankles, acne, cataracts, and osteoporosis. If you experience any of these after effects, you should tell your doctor. In addition, you should figure out ways of coping with digestion, sleep, mood-related, long-term and serious reactions. Method 1: Coping with digestion-related side effects. 1. Suck on mints to alleviate the metallic taste. If you experience an annoying metallic taste, you may want to keep some mints or gum on hand. Chew gum or suck on mints to reduce the intensity of the metallic taste in your mouth. 2. Deal with diarrhea. Upset stomach and specifically diarrhea is one of the side effects of MS treatment. If you are experiencing diarrhea, you may want to increase your consumption of water and eat soft foods like yogurt. You may also want to talk to your doctor about how your diet and medications could be adjusted to reduce this side effect. 3. Drink water, eat fiber and exercise to tackle indigestion. If you experience indigestion or irregular bowel movements, you may want to increase your consumption of water. You may also want to get more fiber in your diet and get plenty of exercise. It is also helpful to go to the bathroom at a regular time of the day, such as after a meal. 4. Eat a good diet. If you find your appetite increases and you start to put on weight during MS treatment, you may want to eat a healthy and moderate diet that is low in salt and high in omega-3 fatty acids. Eating a lot of salt will result in more fluid retention, so you should try to eat a low-salt diet. You should make sure you are getting omega-3 fatty acids from fish, supplements, or other sources. MS makes your body retain more fluids, so you may gain a little weight and get swollen ankles. Try to eat a healthy, low-salt diet so that your body doesn't retain as much water. Use herbs and spices instead of salt to flavor your food. 5. Shop for low-salt foods. You should purchase fresh instead of processed foods and always check the daily recommended value, i.e., DV, of sodium on food products. Look for the following foods when shopping for your low-salt diet. Fresh fruits and vegetables. Low sodium, sodium reduced or no salt added labeled products. Food products with 5% or less DV of sodium. Low sodium or no salt added ketchup. Sodium-free mayonnaise. Method 2: Managing sleep and mood-related side effects. 1. Take pain relievers for headaches. To treat headaches during MS treatment, you could ask your doctor about appropriate over-the-counter or prescribed pain relievers. Ask your doctor, what pain relievers would be appropriate to treat my headaches during MS steroid treatment? 2. Treat headaches with acupuncture. Headaches are more common among people with MS. Unfortunately, treatment can make them worse. If you are finding little relief from conventional pain relievers, you could try acupuncture. Acupuncture is a traditional Chinese medical treatment that involves the stimulation of parts of the body to improve the flow of energy. Typically, needles, heated cups, or finger pressure is used. You will generally need to go for at least half a dozen sessions to see whether the acupuncture is relieving your pain. Use AcuFinder to find state-licensed acupuncturists. 3. Find a therapist to cope with mood swings and depression. Mood swings and depression are common side effects of MS treatment. You may want to see a therapist to talk about your thoughts and feelings about the treatment. A psychologist may be able to give you coping strategies to deal with feelings of loss, anxiety, or depression. Search for a therapist who specializes in patients with MS by using a referral service or asking your primary physician. In addition, you may want to consider alternative therapies, such as acupuncture, when dealing with mood swings and depression. 4. Use exercise to cope with anxiety. Anxiety is a common response to MS. Ask your doctor if there are some appropriate exercises that you could do to manage your anxiety. Exercise is one of the most effective ways of dealing with anxiety and stress. If you are able and your doctor agrees, try going for a daily walk, swim, or join a class at your local gym. You could ask your doctor, what kinds of exercise would be beneficial? Are there particular forms of exercise that are better for people with MS? How often should I get exercise? 5. Practice 7-11 breathing to reduce stress and anxiety. Put one hand on your chest and one hand on your belly. You should breathe in through your nose and into your belly, so you should feel your belly rising and falling with each breath. Breathe in through your nose for a count of 7 seconds. Then, breathe out through your nose for a count of 11 seconds. You can breathe in for shorter or longer than 7 seconds, as long as you continue to exhale for longer than you inhale. For example, you could inhale for 5 seconds and exhale for 9 seconds. 6. Use aromatherapy to deal with sleep problems. Aromatherapy is an alternative medical practice that uses scents to impact your mood and ability to sleep. You can purchase aromatherapy essential oils from a health food store, online, or from some grocery stores. You can either put a few drops in a candle, essential oil diffuser, or in a bath. Try one of the following essential oils to help relieve MS-related sleep problems: lavender, lemon, yuzu, bergamot, ylang ylang, clary sage, jasmine. Method 3. Coping with long-term treatment side effects. 1. Talk to your primary physician about heart palpitations. If you are experiencing heart palpitations, you should tell your primary physician. Heart palpitations are one side effect of MS treatment with steroids. They can also be caused by stress and anxiety, as well as more serious heart conditions such as arrhythmia. Ask your doctor to examine your symptoms. I have been experiencing heart palpitations. Should I be worried? Do you think it is related to my MS or something else? What can be done? 2. Seek immediate medical assistance for chest pain. Find a hospital or a doctor to diagnose and treat your chest pain. Chest pain is one side effect that can come along with MS steroid treatment. However, it can also be a symptom of more serious heart conditions. Since it is hard to diagnose, you should find immediate medical assistance. Take appropriate action to see a doctor. Ask a family member to take you to the emergency room at your local hospital. Go to a walk-in medical clinic. Phone the emergency medical number on your telephone. 3. Cope with acne. Acne is one of the side effects of long-term treatment with steroids. You can try using over-the-counter acne medication with medical ingredients like benzoyl peroxide, salicylic acid, alpha-hydroxyl acids, or sulfur. You can find these products at your local pharmacy. If over-the-counter products do not work, ask your physician to recommend a good dermatologist. 4. Get an eye exam if you suspect cataracts. Cataracts are a common side effect of long-term MS treatment with steroids. If you are experiencing cloudy vision or cannot see well at night, you may have cataracts. Contact your doctor to get an eye exam, which will determine whether or not you have cataracts. If you have cataracts, the recommended treatment is surgery. 5. Tell your doctor about any symptoms of high blood sugar and diabetes. One of the long-term side effects of MS treatment with steroids is high blood sugar and diabetes. If you have a dry mouth all the time, urinate frequently, or feel tired all the time, you should tell your doctor. MS treatment can exacerbate diabetes and even induce diabetes. Tell your doctor if you experience any of the following symptoms: having to pee a lot, thirsty all the time, unusual hunger, weight loss, ketones in the urine. Purchase a ketone test at your local pharmacy and follow the directions on the label. Feeling tired all the time, irritability, frequent infections, blurred vision, slow healing sores. 6. Cope with osteoporosis. Osteoporosis makes your bones weak and brittle, which makes it easier to break them. It is one of the long-term side effects of MS treatment with steroids. If you experience back pain, loss of height, stooping, or frequent bone fractures, you may have osteoporosis. You should make sure you are getting enough calcium and soy protein in your diet and talk to your doctor about treatment options. The most common treatments are bisphosphonates such as alendronate, zoledronic acid, ibandronate, and risedronate. Consume foods rich in soy protein and calcium.